So our conference is going to continue with the next panel, Law Enforcement, Emerging Strategies in Response to Substance Abuse. And our moderator is Nate Stetzer, who is with the Wausau Police Department.
All right, well, I know it's after lunch, so this doesn't say it in the program, but I'm going to ask you guys to do a favor for me. There is a note section in your program, and a lot of this conversation that we're going to have this afternoon is going to be based off of your questions. So if you can think of something, write it down, and we'll address that after each one of our speakers is done. To introduce myself, I'm Nate Stetzer. I'm a community resource officer with the Wausau Police Department. Basically what that means is I get to kind of put my toe in a lot of different things. Mainly I do drug investigations, so I'm buying drugs, I'm conducting investigations to find out where they're coming from and how they're getting here. I also manage all of our chronic nuisance premises, so that also deals a lot with drugs. So when we're having continued responses to specific places, I manage those and come up with a solution to solve those. And lastly, I'm also involved in community engagement activities such as this, where I get to do drug presentations on almost a weekly basis. So that's one of the reasons why I'm involved in things like this. I very quickly learned in my career, especially in investigating drugs, that there's a lot of people that I come into contact with who are struggling with an addiction. And when I first started, I felt I was kind of at a loss where I wouldn't really know where to point people or get them the resources they needed. So I started getting involved in this, and this is one of the reasons why I'm here today, is because everybody here plays a part in getting those resources to the people that need them. So I know you didn't come here to listen to me speak, so I'm going to introduce my panel. First to talk is Lieutenant Randy Albert. He's currently assigned as the lieutenant for the Marathon County Special Investigations Unit. So, Randy?
I had to make a couple of notes just to make sure I stayed on task here. As Nate mentioned, I'm in charge of our local drug task force. It consists of the Everest Metro Police Department, the Wausau Police Department, and officers from the Marathon County Sheriff's Department. We are a whole 6-person unit when we're at full strength. We're supplemented by another unit, the Community Resource Unit at the Wausau Police Department, and I believe when they're fully staffed, that's 4. So you have approximately 10 officers in this county that spend the majority of their time investigating the drug-related crimes that are going on here. I took over the unit about 2.5 years ago, and at that time I was made aware of something called a needle exchange, and the needle exchange is located down in Schofield. Just so I'm aware, how many people are from Marathon County are kind of familiar with this area? Oh, it'd be easier to ask. Who's not from Marathon County? And I'm familiar with it. So maybe you have one of these in your community too. But it's a place where addicts can go and they can get free supplies. So they don't spread, Hep C and things like this, or share needles and spread disease and things like that. And I couldn't believe that we had something like that in our community, so I went down there and introduced myself, but not as Lieutenant Randy Albert, kind of like, hey, I heard I can get some free needles here, is that true? And she's like, yeah, how many do you need? I said, well, a box ought to do, right? She goes, well, are they for you or for a friend? I said, what difference does it make? And she's like, well, I should really know, you should know how many needles you want. I said, well, just give me a box. And she goes, would you like some tie-offs, cooking tins, and Narcan with that? Like, it was takeout fast food. I was really shocked that they were just handing this stuff out down there at the needle exchange. And I did introduce myself to her, and I told her who I was. And I wanted to learn the purpose of this in our community, why we're giving these out. And she gave me a little bit of background, and that's a whole different story. But I did ask her how many needles she was distributing in the Wausau area on a yearly basis. And she told me that approximately 30,000 needles go out into our community every year. And since it was called the needle exchange, I asked her how many she got back. She said they get back about 3,000. So 1 in 10 of those needles that is flying out of there is making its way back there. We also have a methadone clinic here in Wausau. And we have users, drug addicts, from all over northern Wisconsin that drive down here to Wausau to use this resource. And these are people that are trying to clean up their lives. So it's a very strict program that they take part in when they get there. They schedule them very early in the morning because a lot of drug users use late into the evening and then sleep in. It's kind of a running joke, like we don't even buy heroin until 3 o'clock or 4 o'clock in the afternoon because most of them are sleeping until at least noon. So they are doing a service to the community here. And I don't mind it being in Marathon County. I think it's a good thing that we have some sort of treatment facility here for these people. And they're coming from as far away as Iron, Vilas, Forest, Florence counties down here so that they can get weaned off their opiate addiction. The people that are working for me in the Marathon County Sheriff's Department or under my control are a very special group of people, and their selection is very important. It isn't hard to do this job, a law enforcement officer's job, if your whole goal is to see how many people that I can put in jail and how many addicts I can arrest every day. We could go out there and we could arrest people at the user level every day. That isn't who we're targeting. We're targeting the drug trafficking organizations, the organized crime, the cartels, the gangs that are bringing the drugs to the Wausau area. We've had several seizures of methamphetamine approaching a pound this year, working in conjunction with authorities in the Lake Winnebago area. We seized 2 pounds over there. We seized another 2 pounds here. 4 pounds of methamphetamine in the first couple of months of this year is a lot. It's a lot for us. At the first year I was in charge of the unit, I don't think we seized a pound the whole year, and we're up to like 4 pounds already this year. So it is coming in droves, and we are working with federal authorities to try and figure out where it is coming from, because the source isn't somewhere close. This is crystal methamphetamine. It's manufactured by drug trafficking organizations, the cartels. And they are working in conjunction with gangs to distribute it through central Wisconsin. So that's where it's coming from. Heroin, maybe not so much. We've seen a decline in the number of heroin seizures recently, and I attribute that to some longtime traffickers currently being incarcerated, and their people that support them haven't yet backfilled their positions in our community. I was talking briefly about the kind of person that takes to be a drug officer or a drug investigator with the Marathon County Sheriff's Department. I get to select from all the Everest Metro officers that apply and all the Wausau officers that apply. And the number one thing I'm looking for is someone that is compassionate and honest and cares about the community. Because I don't need someone with a mindset of how many people can I go out and arrest. I need somebody that if I arrest someone, they sit down and I want to hear that person's life story. What started them into this downward spiral that eventually ended up with them landing in jail? And I don't want to have them lose all hope because they've been arrested, because they can still turn their life around. And there's a number of different ways they can do that. It's cooperating with authorities, it's taking responsibility for their actions, it's getting treatment. We try and get their families involved if possible. Many times these people haven't spoken with their families for months, sometimes years. And out of the blue, they'll get a call from one of my investigators saying, "We have your daughter here. She's been arrested for possession of heroin with intent to distribute. She could really use your help. Can you come on down here? We'd like to talk with you." And I think it makes a big difference in the number of people that we see going to prison or not going to prison, is a compassionate approach from law enforcement. Everybody that sells drugs is not bad. Some of them are in really tight spots financially, or they've been coerced into doing it. And I thought the gentleman that was up here earlier that talked about the decisions that they make once their brains get under the influence of these drugs, and why a normal person would never do anything like that. But that's the state these people find themselves in. And if law enforcement takes the approach of lock them up, throw away the key, that's not going to be helping the problem in the future. We've got to be part of the solution, and that means taking an approach of care for the individual until that person demonstrates to you that there's nothing that you can possibly do that's going to help that person's plight in the future. I don't have a timer up here. I don't know what they're talking about. It looks like I got all the time in the world on this clock. Some of the other things that my unit does is we go out into the community and we give community presentations to area groups. Some of the recent ones, we did the Rural Nurses group this year, the Wausau Trauma Conference, Citizens Academy, and Marathon County Council on Safety. And I've got a couple others that we got requests and didn't go to. So with that, I guess that in a nutshell is the holistic approach that we're taking from a local drug perspective in the treatment of the individual and prioritizing of our cases. So thank you.
All right, so next up we have Detective Jason Weber. I'm going to say where he's from, and half of you are probably going to go, where's that? But don't you wait, he's going to tell you where that is. So, Detective Jason Weber.
Well, I threw together a little bit of a PowerPoint. First off, though, it's Police Week this week, and you may have seen several of us wearing morning bands. Being where we are, I think it's worthy just to take a few moments here of silence for Detective Weiland, who passed away recently. All right, thanks. We had an active shooter in my community 2 years ago where we had 4 people killed. So what happened here really hit home. In fact, I still wear the bracelet from the thing. So like Nate, I don't stand behind a podium, or Randy, or probably Bob too. But so I'm going to walk around here. As Nate, where are we at here? Oh, Fox Crossing Police Department. So where are we? We just changed our name to Fox Crossing last year. We used to be the town of Menasha. So we're on the northern tip of Lake Winnebago, just next to Appleton. If you ever go over to Fox River Mall, that's right on the border of our community. We have about 18,000, 19,000 people, 27 officers, and we're starting to be the corporate headquarters here of the Valley with a lot of different buildings coming in. How we got involved in drug abuse, or I guess how I did personally, was back in 2008 and 2009. We had a huge increase in pharmaceutical-related crimes. We were the #1 area in Wisconsin for robberies of pharmacies, and my community had 6 homes in the span of 10 days that were broken into, and the only thing taken was prescription drugs. So that was weird, but the second thing, and I'm sure you guys can attest to it, is these homes were broken into, where the doors were kicked in, the windows. Most of our property crimes are unlocked. So that was weird too. I also serve as the vice president of the State Crime Prevention Association, so we have regional meetings. And it just so happened in that spring we had a meeting, so I started talking to my colleagues from Appleton and from Green Bay, and so on, about this weird phenomenon with these prescription drug crimes. And they were having similar issues too. Green Bay was having farming parties. Down in Ripon, they were having issues in the community and around the campus. On the lakeshore, they were having homes or medications being taken out of the medicine cabinet during open houses. So there's a lot of issues going on. So we thought, we got to look into this. We were looking at it from a crime prevention standpoint, really not anything else. So we had a subgroup, and we sat down and we met, and what's the first thing that you do when you research a problem? You Google it, right? So we Googled it, and there was no prevention program or nothing out there. No awareness campaign, nothing, even DARE. Y'all heard of DARE? DARE didn't even have a curriculum at the time. So we thought, you know what, that's our angle, is we have to raise the awareness. Well, this was a group of about 6 police officers. You can see our patches there. And we knew we were really out of our league and we needed some help. So we opened it up and brought in some educators. We brought in some families that had lost their kids. We brought in health care. We brought in juvenile workers, a pharmacist. We really brought in a lot of groups, small, local, big, whatnot, and ended up working on an awareness campaign which led to a educational toolkit called Good Drugs Gone Bad. And in that toolkit, we developed programs, materials, curriculum, PowerPoints, videos, whatnot, for 4 different target audiences. You can see it up on top there, the youth, parents, older adults, and healthcare. So this program was only created for the Fox Valley, for Northeast Wisconsin, maybe at best. That took off like wildfire, and SAMHSA picked us up. We were invited, one of 9 programs, to go to the Service to Science to work to get our program evidence-based. One thing led to another, and 2017, I'm standing here in Wausau talking about it. Who would have thought? But we keep producing this toolkit, which is free, and now we travel throughout the whole United States and disseminate this toolkit to other educators and teachers and stuff, and we continue to be able to produce that and hand that out free. Led to a movie called 1048, which we ended up having a national producer end up doing for us, aimed at high school kids. The other things that we do, you know, law enforcement, enforcing laws tends to be kind of a small part of the issue, at least for us on a local level. You know, we're solving problems. You know, we want to take care of issues. We're one of the few professions that the less we do, the better off that we're doing. You know, the lower our numbers are, the better job that we are doing. So prevention is a big focus. We had some extra money left over from donations from the Good Drugs Gone Bad toolkit. We ended up going out and buying drug testing kits. Because every now and then we would have parents ask us, you know, what's a good drug testing kit? You go to Walgreens, Shopko, and, you know, there's a whole bunch of different kits. You know, are they good? What's the credibility? So we ended up buying drug testing kits. These are actually the same drug testing kits that probation and parole uses. So we thought there's got to be some science or some credibility behind it if they're locking offenders up. We also certainly did not forget about our efforts in enforcement. My role is very similar to what Nate's is, as I do a lot of the community policing. We have the chronic nuisance ordinance. We have the drug nuisance ordinance. We're able to go into a community and help eradicate those drug houses. We get a lot of calls from neighbors finding discarded needles. We've had thefts in neighborhoods of first responders. We have a paid-on-call fire department, so our first responder guys live at home and they respond from their car. Some of the neighborhoods we've had the cars broken into looking for Narcan. So a lot of issues that happen in the neighborhoods. What we do is we work with our neighborhood watch groups. We have that because they're the eyes and ears of that neighborhood. They provide us with the intelligence, with the information of the license plates. I've had some of them even will take pictures and send us pictures of those cars. And then what we end up doing internally is we data mine that information and we find out who these people are, and we work out on building a case. Just in the last 3 years, we ended up shutting down 3 drug houses. 2 of them were meth and 1 was on ecstasy. 2 of them actually we ended up working with our partners in the DEA. That's how large scale of an operation that they came. But it was a partnership. It was a partnership. We couldn't do it alone and the neighbors couldn't. We had to work together on that. We also raised the awareness with different presentations, billboards, social media. traditional media. These are things that aren't out of the reach. I don't know how many of you are on coalitions, but these things really aren't out of the reach. The first billboard that we did actually had to deal with our chronic nuisance ordinance, and it was just kind of a thought in the wind in the middle of the year. Summertime, the billboard company gave it to us for the cost of to make the sign, which was $94. And they worked with us and gave us the billboard all summer long. So it really doesn't hurt to ask. You know, if you are on a coalition, don't ever think some of these are out of reach. And then on the tail end, you guys heard Jesse this morning. Actually, Jesse, I don't know where he is, but him and I carpooled, so he's got a... he is here somewhere, otherwise he's walking back to Appleton. But we started to partner up with Jesse and the recovery coaches to be able to hit some of these people that overdose and survive, thankfully. But the goal or the program is to be able to connect with them within 12 hours, 24 hours after that, hopefully in a moment of clarity. And we can make that connection and get them to those resources. Jesse works for the Iris Place, which has some beds, and we just recently in the Valley are trying to get the Gloucester model in, and some of the communities are starting to work with some of the rehab clinics there. So stuff on the tail end. We have a lot of resources out there. We have a website. It's called Good Drugs Gone Bad. It started out just as prescription drug abuse, but it has evolved into emerging drug trends. It's what a lot of our presentations are now. And then, as I said, we experience an active threat thing, so we do talk about active threat. We do seminars on that, and social media, which is a whole other day-long thing. But we have a website, so if anybody's looking for resources, you can end up going there, or Facebook. That's my email. The email in your program is wrong. It was when we were the town of Menasha. It's foxcrossingwi.gov. If you're interested in the Good Drugs Gone Bad Toolkit, it is electronic based. We used to make it more of a physical, tangible type of thing, but that was created before Dropbox was made, so now we use Dropbox and can send it out electronically. So if anybody's interested in that, I'll be around at the round table. Otherwise, shoot me an email. So thanks.
All right, so now you've had the opportunity to hear from a local jurisdiction, from a county jurisdiction, and now we leave it to the feds. So this is Robert Bell from the DEA. So he's going to share some really good information with you too.
Good afternoon. I'd like to, of course, thank Wisconsin Institute of Public Policy and Service and North Central Health Foundation Conference for the invitation today, as well as Corey Norbaum and Nate Stetzer. Thanks for including us. As well as you. Thank you for what you do every day and what you'll continue to do going forward. But what a large, great group of people. And when you look around, look at all those people, all the know-how and all the commitment here. So thank you for what you do. I'd like to talk a little bit about DEA, what we see and do from our perspective, and a pilot program that we rolled out in Milwaukee. Was one of the 3 first cities in the country to try our 360 strategy and try to make it work, see what worked, see what didn't work, and we continue to roll those out across the country. But just in terms of the scope, and I'm gonna break from the ranks and stand behind this podium in case anyone wants to throw a tomato or anything like that. But scope and severity, I mean, of course, I won't throw out a lot of data during this. We all know how severe the problem is. You're all experts in this, and that's why we're here. But of course, it's been sweeping and crisis level and horrific, and we know that. I'll just state for the record, DEA's national priorities over the last several years have been on opioids, heroin, and fentanyl, and the violent organizations that traffic in those substances. And that will continue to be our focus. Meth came up. Methamphetamine availability, it has skyrocketed the last several years. Wisconsin, like much of the country, but Wisconsin is awash in methamphetamine. But I think you have to come back and look at the overdose death data, and when roughly 3/5 or 35,000 of the 52,000 drug overdose deaths in 2015 are a result of opioids and heroin. We have to say, hey, that's got to continue to be, that's the preeminent threat, and that's got to continue to be our primary focus, I think, law enforcement and outside of law enforcement for the continuing future. We can hopefully walk and chew bubble gum, but certainly opioids, heroin, fentanyl, and other synthetic opioids have been severe and will stay the priority, at least for us. When we think about the dynamics here a little bit, we know we have this pharmaceutical opioid and heroin cycle of abuse, but what we also have now, and I think many of us recognize it, is an absolute collision of the pharmaceutical opioids and the heroin chronic health dependence problem, and there's public safety aspects with that, of course, as well. Huge public safety aspects, but that has collided with the novel psychoactive substance or synthetic drug problem. I don't know how many people know these numbers, but I think this bears or warrants throwing out. More than 400 brand new psychoactive substances have entered the U.S. since 2009. So finished product, 400 different substances, unprecedented, from 8 different structural classes. And so one of those groups or classes, opioids, of course, of which fentanyl falls under. So we've got a collision here of these two problems together. And over the last year, I'll just use Milwaukee County as an example. 2015 was around 255 drug overdose deaths, and 2016 was about 348, I believe. The extra 90-some, or close to 100, fentanyl. So that's the X factor that has just really changed things. And so what a severe public safety crisis that has posed, in addition to the problems we already are dealing with. Some of the steps that we have been taking, of course, enforcement's a huge part and our cornerstone of what we do, but we also have scheduling authority. So since 2011, we've taken 12 emergency or temporary scheduling approaches or actions and have scheduled over 37 new substances as Schedule I controlled substances. And that includes a number of fentanyl substances, and that will continue. Also, we as an agency set the quota, the amount of available controlled substance, whether it's Schedule I for research or Schedule IIs through 5s, the total amount that can be imported, manufactured, but essentially be in our country for each year. And we've reduced the quotas of a variety of opioid medications, oxycodone, hydrocodone, what have you, by 25 and sometimes up to 30% in 2016 to try to limit the amount of available supply, even of pharmaceutical medications, pain medications. China. So we know that the fentanyl and most of the novel psychoactive substances or synthetic drugs, if we want to refer to them as that, are coming from Asia, most of them from China. Demagoguing China probably isn't going to be productive. We've been in a real systematic way engaging and interacting with China since 2011. It took time, but by October 2015, they actually scheduled 116 synthetic substances. And the positive thing about that, while it doesn't resolve everything, the positive thing is that when we look at those substances that were controlled, if you look at a chart, the availability and the appearances here in the United States absolutely plummeted and dropped down to 0. So essentially turned the spigot off on most of those 116 substances. So then, March of 2017, a couple months ago, China just scheduled 4 fentanyl substances. And that's out in the public domain, so some of you, I'm sure, are aware of that. A colleague of mine just arrived back from a working group with our Chinese counterparts 2 weeks ago and talked about controlling more fentanyls in China, and dropped off a list of more than 25 different fentanyl substances and with all of the publication information, morbidity, mortality information, pharmacological information. So we'll see what comes of that. So we're hoping to turn the spigot off so we have less substance to contend with here in terms of fentanyl. Bears saying that, once again, most fentanyl we're dealing with that we see that's causing the problems, causing the deaths, is illicitly manufactured. It's really not a diversion problem when we come to fentanyl like it is with the pills. So it's, for example, carfentanil. The quota for carfentanil is 19 grams, and we haven't had to change that in years. when you're talking microgram levels being enough for what needs to be done with it, there's not enough to be diverted for what we're seeing on the street. So this is clearly an illicit drug problem where fentanyl is concerned and heroin is concerned, not a diversion problem. The other thing we're seeing are a variety of counterfeit pills that look legitimate, they contain fentanyl. We're also seeing Mexican transnational crime organizations manipulating fentanyl to make it look like black tar heroin. So to try to gain increased market share, increased profits, they're playing on people's trust that when they get a pill that's stamped oxycodone, that it's really pharmaceutical oxycodone, that's the only thing it is in the right dosage as marked, et cetera. And someone with black tar heroin, typically lower percentage purity, but in this case, if it's fentanyl, of course, a small amount can do a lot of damage, cause death. So just want to turn the page to our 360 strategy. Really, the 360 strategy is our recognition at DEA, and I think in large part you're hearing that across law enforcement, that we cannot do it alone. We recognize that. We need to work together. We rarely do anything of note in law enforcement alone, and with this problem, we're not going to do anything of note just law enforcement. We need to engage the medical community, healthcare community, non-government organizations, service organizations, and agencies, and we recognize that. So I think it's important that we say that out loud and say it publicly. So 360 strategy is a holistic approach where the three pillars are enforcement, diversion control. I'll talk a little bit about that and what that looks like. And then community engagement, community relations. So enforcement-wise, we focus on large-scale drug trafficking organizations. We always traditionally worked up the chain, back towards Mexico or whatever the source country was. What we've been doing the last several years is working up, but also working down to the violent street gangs, those that are perpetrating violence in our streets, and trying to go both directions, essentially, make a difference that way. Enforcement successes. We try to connect enforcement a little bit to community outreach by using enforcement successes and the media to talk about those successes, but not just to slap high fives and say, hey, look what we did today, but to get information out and raise the public's awareness about what the underlying problems are. So really to draw attention to the issues. Diversion control. DEA, we have oversight of a large, I think 1.6 million registrant population. So that's pharmaceutical manufacturers, distributors, prescribers, dispensers, and what have you. So once again, that means investigations sometimes. It means audits. It means some of those types of things. But of late, it's meant also our effort to engage the professional medical community in educational discussions and also just good positive discussions in terms of bringing to bear both disciplines on the problem together in a cooperative way. So that means those positive things happen, but sometimes there's still some egregious behavior that's outside of the law. In those instances, we do conduct investigations and bring those cases to the U.S. Attorney's Office or to state district attorneys for prosecution. One example, though, is some civil action, and I don't know how many are aware of this, but recently, effort in the Western District of Wisconsin, an investigation went civil, and McKesson, one of the largest Schedule II opioid pharmaceutical manufacturers in the country, they just weren't verifying suspicious orders that were going out, and we're talking millions and millions of pills, and the judge ordered a fine of $170 million, the largest fine in history. So that's some action we're able to take in that area. Recently, as an example, and I certainly don't want to demagogue physicians because we know 99.9% are trying to help people, just like we all are. But when there is that egregious behavior in the Western District, again, another example from a week ago or so, a physician was just sentenced to 16 months incarceration for falsifying prescriptions, stealing drugs, using drugs, selling drugs, and it's just way outside of the line. So no choice for us there. A little more positive note, we all know about Take Back. April 29th, we had our 13th National Take Back that we coordinate in cooperation with the Wisconsin Department of Justice and with all law enforcement in the communities around the state. And I have to tell you that I think we should be maybe proud and maybe a little scared, but Wisconsin brought in the third highest amount in the country, next to California and Texas. Wisconsin brought in about 66,000 pounds, or over 30 tons of unwanted medication. So I guess that's good and maybe bad, depending how that cuts. But tremendous amount of coordination and effort and work to take those unwanted drugs out of our medicine cabinets, off the streets. So we'll continue in that, with that initiative as we go forward. As I wrap up here, the community engagement and coordination piece, so that's the third pillar of 360 strategy, and really the thing that was new for us. And so we've had a lot to learn, and we continue to have a lot to learn. But we tried to work very closely with non-government organizations, service agencies, elected officials at the local, county, and state level, as well as with state, county, city opioid task forces. And it's been a very good thing. It got us outside of our law enforcement silo. Like, we're pretty good now at cooperating amongst ourselves within law enforcement, but this got us outside of law enforcement. And I think it's been very positive for us and our coalition partners. The 360 strategy is a one-year formal initiative. And then from there, really those organic relationships that were formed, we continue to work as it makes sense for us to work on opioid task forces with the State Controlled Substance Board, prevention organizations, with the media, et cetera. And we'll continue that. But I think one thing I saw when we started bringing the community together in our initial meetings was that, I thought we were bad in law enforcement years ago in terms of being siloed and protecting our work, our cases, what have you. And I think I saw a little bit of that in the outside of law enforcement too, where there were tremendous organizations, but everybody wasn't necessarily talking and working together. And so that was kind of interesting to see people sitting down in a room and figuring out, like, hey, you do that too? Maybe we can partner on this. And it was a positive thing. On the formal part, I just want to rattle off some of the things we did, the formal part of the community outreach aspect of 360. We had an initial, last February of 16, initial stakeholders meeting, then a kickoff press conference, followed by a summit in the summer, an opioid heroin summit, where we brought over 250 people together. Partnered with Partnership for Drug-Free Kids to do a Train the Trainer event, where we trained a group of people with a nice PowerPoint prevention presentation, and then made that available so that they could go out, provide that to their folks back at their organizations, and present those to the community wherever needed. DEA youth dance program. So I know many of you are envisioning me in a tutu, but that isn't the case. Our DEA foundation, educational foundation, which is not part of the federal government, it's a 501c3. The dance program is part of that, and we brought professional dance instructors into several schools, to kids, high-risk areas, from the 3 o'clock to 6 o'clock time frames, and kids that showed an affinity and an interest and got their positive messaging and some drug prevention stuff salted in there, received scholarships to go on and continue in dance as part of that program, free of charge. So that's just an example. A couple more examples. A digital billboard initiative with Clear Channel Outdoor with prevention, treatment, access information. And then we did media visits all around Milwaukee to the local affiliate stations and sensitized them to the issues with a kind of a diverse group of 6 or 8 coalition partners, elected officials, myself, medical society folks, medical examiner folks, Boys and Girls Club, you get the idea. And I was amazed. I didn't know what kind of attention or time, how much time we would get out of these folks, but we would end hoping we'd get a half an hour. The shortest one out of 6 was 45 minutes, and the longest one was an hour and a half. And now Channel 12, or I should say Hearst broadcast stations, 33 of the Hearst stations nationwide are doing something, a one-year program this year called State of Addiction, where they're highlighting all of these types of problems. They're doing phone banks, PSAs, on and on, making this their thing for a year. So just those visits, and that with Partnership for Drug-Free Kids together with them, got that going. So that's something that can happen in any community, I believe. wrapping up, I think sometimes in law enforcement, we've done a terrible job of describing what it is that how we serve and what we care about and what we do as a mission. A lot of times we talk with, in a very sterile way. What do? We enforce the drug laws of the country. We dismantle drug organizations. I don't think that means much to most people. And I think we need to really communicate more clearly, because what we do is try to make safer and healthier communities. We try to protect the most vulnerable among us, which is what all of you are trying to do as well. We try to save lives. And I think we need to just talk more clearly and state it in plain language that people care about. So I reiterate, we know we cannot do it alone in law enforcement. I look at this room and I see that we're not. So very pleased to be here. Thank you for everything you do every day and everything you'll continue to do.
All right, so I did not use the psychology I use on my kids. I told you all to take notes. Unfortunately, we do not have enough time to take those questions right now. I can speak for myself and a couple of the other ones that we will be around this afternoon after the event. So if you do have those burning questions that you want to ask us, feel free to ask us those questions then. Just to kind of recap, in law enforcement, we often partner with other agencies, especially when we're dealing with substance abuse, that there are some topics that we cannot do alone. So our job in law enforcement is to hold people accountable for their decisions, yet we understand that we are not going to arrest our way out of this problem either. So partnering with people such as yourselves is really a key to success for us in law enforcement. So with that, I want to thank you all for allowing us to come and speak to you today. Thank you.